Yeah, so we were talking about light sensitivity earlier, and I really like to hear about light sensitivity because it really, there can be a couple different causes of it. And what we look at with light sensitivity is like, is there a sympathetic overdrive? Is there this fight or flight system in overdrive due to errors in brain inhibition? Or is it due to, or it can be both, right? Or is it due to this convergence accommodation mechanism that's not working well? And so what I like to do when I look at patients is I like to see, okay, if there is a light sensitivity, is there a problem constricting the pupils? Because that's usually the reason they have light sensitivity. That's where light comes through. You can't have light sensitivity if you constrict your pupils well. It just doesn't work, right? It doesn't work that way. So you have to have some kind of problem constricting your pupils. And it can be in both, or it can be in one. And what causes that are, as we talked about, the sympathetic nervous system, which can be overdrive, which is going to dilate pupils. So it's going to make it hard for you to constrict your pupils. So it's going to make them bigger, like a cartoon, right? And the person gets scared and their eyes get big. Well, your pupil actually gets big. And so then you can't constrict it to gate light input to your brain. So then you get too much light to your brain, which overstimulates your brain, creates all kinds of imbalances, creates symptoms. You get migraines, headaches, dizziness, fatigue, brain fog, all these things that happen because you can't gate light, and it creates this imbalance in your brain. And the other thing that causes it is also a big pupil, but it's due to the inability of the eyes to come together in a convergence, right? So when I look at something close, if I follow my thumb all the way in, what you notice is that my eyes have to come together to look at that thumb equally at the right angle to give a nice clear product or image. And because I need to have, the image has to hit the right part of my retina in both eyes. What happens for a lot of people is that, and when that happens, I should say, as they come in, the pupils constrict. It's a mechanism, it's a reflex. So it's called the accommodation reflex. What happens for a lot of people after brain injury, concussions, migraines, all kinds of neurological issues, chronic neck issues, is they'll lose the ability to bring their eyes together in the same plane. So one eye might come in, the other eye might not come in very well, or both eyes might not come in well. That's called convergence insufficiency. And why that's important, it's not just because it causes double vision, it causes eye strain, causes headaches, causes reading difficulty, causes depth perception, spatial disorientation, all kinds of things. Neck pain because of the way your neck compensates because your eye can't come in well. But in reference to light sensitivity, what happens is if that eye can't come in all the way, that pupil cannot constrict because you're not meeting the whole reflex. It's not going through the whole path of the reflex arc, so you can't get that constriction. And then when your pupil can't constrict as well, it can't gate light once again. So there's like these two mechanisms of light sensitivity that as you know, we can help with, that we do all the time. But we have to identify not only which one is causing it, but also where in what we call the neuraxis, or the different parts of the brain and their connections, these neural pathways, where are these neural pathways broken down so that they're not sending the right message to allow for the right action to occur. And that's what, as we do as functional neurologists, as chiropractic neurologists, that's what we do, is we figure out where the source of the problem is, and then we target it with neuroplastic rehabilitation exercises to restore function and connection within these areas, thus reducing and remediating the symptoms. Yeah.
A lot of people with